Hello all. First of all, I would like to thank the scientific committee for giving me this opportunity. Moving on to my topic. Today I will be discussing my experience about handling small pupil cases. As surgeons, we get exposed to different type of cases which may be complicated to start with or may develop complication intraoperatively. So, it is important to do your homework beforehand and plan each case accordingly, especially when you are new in your practice. Small pupil, that is iris sphincter sclerosis, may be caused by aging, synapse formation, previous trauma or surgery, diabetes. In uveitis patient it is commonly seen, pseudoexfoliation, and also intraoperative floppy iris syndrome. It is very important to identify the cause before planning the surgery. Preferring a block over topical whenever the situation demands, and so on. Staining with ripened blue dye provides for better visualization, allowing the surgeon to perform the capsular access with greater safety and much more confidence. Dealing with small pupil is always challenging. Here I am using the Y-hook spatulas to stretch the pupil to attain some good adequate pupillary dilatation. Good pupillary dilatation helps us in rhexis formation and the subsequent steps. While using the Y hooks, one should be careful about not injuring or traumatizing the iris sphincter, as it may lead to iris bleed and make the case difficult. Good pupillary dilatation enables us to place the toric IOL at the required axis. Posterior synechiae have to be carefully dealt with. Using the iris spatula can thoroughly release the synechiae from the anterior lens capsule and help in adequate pupillary dilatation. There is a routine case which was planned for toric IOL placement. A few minutes into the case, I noticed that the pupil is getting smaller and the iris is becoming floppy. At this point, I stopped and talked to the patient and asked him whether he is using any medications for his urine or prostate problem. The patient replied, "हाँ डॉक्टर साहब, मैं तो एक टैबलेट काफ़ी सालों से खा रहा हूँ." I was surprised and I asked him कि आपने मुझे चेकअप के टाइम क्यों नहीं बताया जब मैंने आपको पूछा था. He was like कि मुझे लगा ज़रूरत नहीं है, एक ही टैबलेट है, ये बताने की ज़रूरत नहीं है. Feeling helpless, I continued the case. I used epitrate and viscoelastic injection to maintain the pupillary dilatation. And luckily for me, I could finish the case well and the lens was placed well in the position. Dealing with inadequate dilatation, it is important to be vigilant about your surgical steps as to not touch the iris with the instruments. Also, maintain the anterior chamber and keep the phaco parameters at the adequate settings as to not cause any pupillary pull or alteration. Successful case can be achieved even with a small to moderate pupil size without using any pupillary dilatation devices. It is important to plan each case individually and be vigilant about each and every step. A well done case makes you sleep well through the night.